Does Portugal have free healthcare? It has socialized healthcare. So what does that mean? That means that tax dollars go towards paying a state-run universal system. And yes, if you are a resident or a citizen in Portugal, you will have access to that system because you will also be paying into the taxes. To access it, you have to get a healthcare number. I got mine when I first got here. It was super simple to do, but I've heard lots of horror stories since then about how difficult the process is now for new immigrants. But obviously, once it's done, it's done. You don't ever have to do it again. It's yours for life. And then you can access the system. But then the next question is, how easy is it to access? And the answer varies a lot. You're required to go get care at the health center closest to your registered address, assuming it's non-emergent care, right? And how quickly you can get that care will depend on how busy that center is. So generally speaking, if you're in the middle of Lisbon, you're going to have much longer wait times than if you're out in rural Alentejo. But out in rural Alentejo, you might have issues of not enough doctors. So it's complicated. I know somebody who had a baby here in Setúbal several years ago, and she was past the time when it's like they induce labor because it's not safe for the mother anymore, but she had to stay in hospital for several days because there was nobody to deliver her baby. So she basically had to keep going past that unsafe date until a doctor came. So if you are in a financial position where you can pay for private health insurance in Portugal, you should. Not only is it probably going to be better and easier for you, but it's also not going to put you as an extra burden on the state system. There are lots of different companies. I personally have Multicare. I have a very low level of it. So a lot of you, when I talked about the price of my colonoscopy, were like, get private insurance. I have private insurance. But I have such a low level that it only pays for like general annual checkups, and it doesn't pay for that kind of outpatient procedure. And I could have gone and done the colonoscopy public, but it would have taken me a very long time. Because to start with, I would have had to get a referral to do the colonoscopy, which means I would have had to get an appointment with a gastroenterologist. And that could have taken months. How many months? I don't know. But personally, I was just in a position where it was worth it for me, for peace of mind, to just pay the full cost. I actually didn't know 100% that my insurance wasn't going to cover any of it, but that's a risk I was willing to take, again, for my personal peace of mind. And obviously, you could also access the public system and pay full price. You don't have to have insurance to access the public system, but then it's always going to cost you more.